Now, like me, I'm sure wherever you are in any part of the world, you really do get fed up with all of these stories about how certain things, particularly within government, are in crisis. Over here, without a week goes by where the NHS is in crisis. Seemingly every day there's another crisis looming. But how in crisis truly is the NHS? As ever, let me explain. Hi, good morning, Neil Sean here in the very heart of London. Nice to have your company today. As I said in the intro, it's interesting, isn't it? Because you wake up, you see the headlines and it's all this struggling, they don't know how they're going to manage. And yet when I've been to a hospital, it seems to be relatively well run. The hard-working people, as I've said many times before, for me are the cleaners, the lower paid end of the doctors and the nurses. They're dedicated, they really do look after people, As I've often said, it's often here, the management structure that is the letdown. You often find that with every big company though, don't you, in the end? It's people taking a lot at the top and seemingly doing not too much for it. What's interesting here though is, and it's something that we've uncovered, and it's not a standalone incident. Recently, it's been revealed that a nurse from London had been self-paying herself for shifts by simply being able to sign off shifts that she never worked. This resulted in payments of up to £18,000. That's right, £18,000 for work that she never actually did. But you see, there was nobody managing that particular department. She wasn't necessarily a manager of that department, so was allowed to sign off the shifts. Well, further disclosure, and we've been able to uncover that other people have been doing very similar things, but seemingly over in the top level management of the NHS, and as ever we have to say allegedly, they want to keep a lid on that, they don't want people to know. As we've often told you here on the show, when you look at the donations that they get through wills, through good gestures, through fundraising, what about the 30 million by Captain Tom Moore? Where did that go? Seemingly that part of it went on this nurse's money. What's really interesting is, it appears, and as ever, we can't find this little bit out, but we will keep digging for you, it doesn't appear that she'll have to pay it back, because it looks like it's a misdemeanor of a higher level. Interesting, isn't it? So can you imagine how well the NHS would run if they actually had some proper management literally running it? Now, a lot of people over here in the United Kingdom want to see the return of the matron. The matron really did rule the wards with an iron rod, but you didn't see too much of this skullduggery when matrons were in charge, and more importantly, when hospitals weren't centralised with the money being doled out by seemingly people that have zero control over where the money goes, has been proven with this particular case. As ever, we'll keep digging away to bring you the stories that truly matter to you. But next time you can't get an appointment at a hospital, or indeed, at your local doctor's, re-look at their services. You'll find many things online about how they operate with their profit and loss account. And trust me, it truly is fascinating. But it's not what the doctor ordered. Neil Sean in the very heart of London.